Mr. Nibs is a 1-year, 8-month-old French Bulldog that was brought to the University of Illinois Soft Tissue Surgery Service for evaluation of lifelong respiratory difficulties.
Hi, my name is Jennifer Hanna. I have Mr. Nibs, and he got the late procedure done because he could not breathe through his nose. He was trying to breathe through his mouth. He was struggling. He couldn't sleep. He would try to sleep standing up. He would try to sleep with his tooth hooked into the crate if he was in the crate during the day. So we did everything we could to rule out anything it could have been. And we just knew that he needed something more than a regular vet could take care of, or our vet here in New Orleans.
Brachycephalic obstructive airway syndrome is a chronic progressive disease due to the conformation of brachycephalic dogs, or dogs with cranially foreshortened faces. This means dogs with kind of squished in or pushed in faces like English bulldogs or French bulldogs. Although historically called an airway obstructive syndrome, the condition has been advocated by many recently to be termed simply brachycephalic syndrome. This is because so much more than the airway is affected. These dogs suffer not only from airway obstructive disorders, but also from heart, lung, gastrointestinal, sleep, activity, and lifestyle-related afflictions that contribute greatly to a decrease in the quality of life. We, as surgeons, have focused on the soft palate, on the laryngeal saccules, or an area in front of the throat, and also on the external nares. However, Dr. Gerhard Echtering recently has pioneered 2 new procedures that may revolutionize the treatment of brachycephalic airway syndrome in dogs. And these seek to deal with tissue inside the nose, termed the vestibulum nasi, and also abnormal formations of normal tissue within the nose, termed aberrant turbinates, or increased mucosal contact between the turbinates.
Mr. Nibs had a CT scan of his head, neck, and thorax performed. A CT scan is an advanced imaging technique that allows for 3-dimensional evaluation of bone and soft tissues within the nasal passages. The CT scan revealed narrowing within his nasal passages and stenotic nares. Mr. Nibs was then taken to surgery to have the late procedure performed.
Laser-assisted turbinectomy, also known as the late procedure, seeks to remove via a diode laser what are called rostral, or front, and caudal, back, aberrant turbinates, or abnormal tissue or an abnormal proliferation of what is the normal tissue within the nose, or to also remove what are called increased mucosal contact points. These are areas where the normal nasal tissue is overgrown and actually touching each other where there should be spaces, and therefore it obliterates the space within the nose for the movement of air.
Now that Nibs has had his surgery, we're going on, it's been a year this May that he had his surgery done. He can breathe. He's a puppy now. He went through his first year of life not being a puppy because he couldn't play. He was always tired. He would run out of breath. And now he torments his brothers, and he swims in the pool, and he dives under the water, which is insane for a French Bulldog. But he has so much more energy now than he ever had. It's crazy to see the difference in him now compared to back then. He's sassy. That's all I can say about Nibs, is he is sassy now.